How you doing? This is Ian Wilson from the SAFIRE conference in Cape Town, South Africa. I'm here with my esteemed colleagues, Dr. Janice Newsom and Dr. Charles Sanyika. So today is the second to last day of a conference here in Cape Town that's called the SAFIRE conference. SAFIRE standing for the
Society of African Interventional Radiology and Endovascular.
Absolutely. So the mission of SAFIRE, as it was founded, is what?
Right. We want to provide minimally invasive management on the African continent for everyone. We have got 1.1 billion people in sub-Saharan Africa, and with limited access, limited or no access to minimally invasive management and treatment of diseases. There's no doubt about the demand for this service. And these are efforts to build this facility for everybody on the continent. But gathered here, people from all corners of the continent, and the support of the rest of the world. We've got people from Asia, Europe, and the USA, like I have here. And everybody is in support for this venture. And we're going to make it happen. And the topic of our keynote address today, given by our esteemed sister here, was IR in Africa. We are on a mission.
Absolutely. Because this mission includes missionaries. And if we're doing a mission, we're actually looking for the collaboration of many so that we can achieve our goals. And so, yes, right here at SAFIRE 2023, we have the leadership of some of the organizations all across that's dealing with IR. The Society of Interventional Radiology leadership, they're here. CIRSE leadership, they're here. SAFIRE leadership, they're here. The SAFE leadership is here. And CARES leadership, they're here. Because this is an issue that we know that we have to solve, but no one person can solve this. This involves all of us. And so we are on a mission. And no matter what, we know that we will accomplish this mission together.
Absolutely. One of the most impressive things about this conference is the collective belief that change is possible. I've seen that with all of the colleagues who are here gathered, esteemed folks from all over the world have converged on Cape Town at your invitation, at the greatest invitation of SAFIRE and leadership in support of what is something that is, I can only describe as mission work. This is legacy work we're trying to do, changing the provision of care on a continent. You think about it, that's pretty significant work.
Oh yeah, the whole continent.
Yes.
A continent.
With zero service.
Yes.
And we're going to make it happen.
Absolutely.
And it is happening.
It's happening.
Yeah.
Absolutely.
It's no longer a dream. There's already started on the continent.
Absolutely. Absolutely. So I'm going to pause and gather another colleague if I can get Fabian.
Oh, I will go get Fabian.
You can get Fabian?
So just hold on.
Okay.
Yeah.
All right. So we'll just keep talking.
Yeah.
Here,
We're going to get Fabian. Is one of the guys who believed in the dream of creating this service on the continent. He's originally from Germany. He's now at Yale.
At Yale University.
Yeah.
Yeah.
And he came here as a med student and planted a seed, which is now bearing fruit.
Absolutely.
We have produced a couple already in Tanzania. And we're going to build this country by country on the African continent.
Absolutely.
Yes, Fabian.
Absolutely.
My brother,
So,
you're going to come in here.
Dr. Fabian from Yale University. Tell the folks in the world a little bit about your story and what we're doing here.
So I'm a young interventional radiologist, aging, but I could still consider myself young. And I've been working with Charles, Ian, many other people for the past 5-6 years in East Africa. I'm primarily based on the East Coast in the US. But basically what we've tried over the past few years is to build interventional radiology training programs here, because many parts of Sub-Saharan Africa in particular have not enough specialists in interventional radiology. So essentially what we're doing is that we have people like Charles, Ian, myself, many others, Dr. Newsome, many others, come to the US, come from the US, come from South Africa, come from Europe to East Africa every month and train fellows there. And so now we have training programs in Tanzania, and we just started also in Rwanda and in Uganda. So the idea is just to train as many specialists as we can, and ultimately to help as many patients as we can.
Now, that's talking about making an impact, right? I think if we can wrap all of those things into one word, I think it would be impact, right?
Yes. Right.
So tell a little bit about the different disease that we're treating, the different disease and conditions that we're addressing, with this.
All right, it's a wide range. We start from basic medical problems to complex problems. We've got a huge burden of cancer on the continent. And interventional radiology is central in the management of different complications of cancer. And for years, people did not have access to this. Where complications of cancer, not necessarily from the cancer, that we could manage. And for past 5, 8, 10 years, we are now able to provide this on the continent. People, the people have got vascular diseases that needed to be treated. A lot of legs have been lost and amputated on the continent because there was no options for minimally invasive treatments. People, we don't have access to a lot of transplant treatments on the continent. We need bridging treatments to get them to transplant if they eventually can get transplant. But sometimes what we do is definitive treatment for patients. So it's a wide variety of them beyond what the world thinks of Africa, that Africa is full of infectious diseases. And we now have a lot of other burdens of non-communicable diseases where interventional radiology is crucial in managing them.
Absolutely. So Fabian, what do you think about the quality of our training programs here on the continent? What do people don't know about what we're able to do or what we're doing?
Essentially, we try to do exactly what we do in the US in terms of training. And, for the Tanzania program, we, most of the trainers were from the US, Europe, South Africa, and essentially the goal was to have exactly the same standards of training that we have elsewhere. Of course, there were some limitations, especially in terms of equipment. So, we had to make some adjustments, but our goal is really to graduate interventional radiologists that can operate at the same level that, someone who graduates from Yale, Harvard, wherever else in the world. So, we really try not to make any compromises in the quality of training. Of course, every country, there's going to be a different focus in terms of, disease prevalence, in terms of, what equipment is available. So of course, there's some differences, but at the end of the day, we want physicians that are capable and that are able to help patients.
I think that's significant work. You talk about doing purposeful work, spending your life in training, education, making a difference, making an impact. I don't see how much more of an impact can be made than training doctors to take care of a continent. It's a huge responsibility, something that we don't take lightly at all. We basically saying to these countries that we are training fellows, Tanzania, Rwanda, Uganda, we're saying to these countries that the people who are being trained are equipped to take care of countries, right? Because that's kind of what the impact, of this education.
And I think in terms of medical professionals, you can't get a bigger bang for your buck than an interventional radiologist, because interventional radiologists are really a jack of all trades. Like interventional radiologists are like general surgeons were 50 years ago. We can do pretty much anything. We can treat head to toe. We can treat from very basic procedures to extremely complex procedures. So some of our procedures are 10 minutes, others can be 10 to 15 hours. So it's a very broad field, and we can help so many patients in so many different situations. So, if when I look at countries that have some deficits in terms of their healthcare infrastructure, by even just adding a few interventional radiologists, you're adding so much capacity. So that's the way I look at it.
Absolutely. Yeah. At my hospital, when I'm at work, my cap is a label here, says call IR, IR for interventional radiology. So people ask me, what do you mean? I'm like, okay, whenever you're not sure about how to solve a problem, call IR. We might have a solution for it.
Absolutely. Absolutely. Solutions for cancer care, vascular care, amputation prevention, so many organ systems. We can treat conditions within a variety of organ systems with these tools that we have, which offer minimally invasive options. And we talk about some folks that have vascular disease, here in South Africa. There are things that can be done for amputation prevention.
Right.
Right.
Yeah. And if we look at cost saving that we give to the health services, that initially people talk about the high cost of the initial equipment and that you have to purchase. But long-term savings for the health service is unquestionable. And this has been published and is proven across the board. So what I've started talking about, they always talk about primary health care, and then you must have access to clean water. They said IR is one of those. So IR is now part of primary health care requirements.
Amazing. It's going to take a lot of partnership and coordination and collaboration, right, to realize a lot of these goals, which are definitely worthy. So I just want to sign off at this point. Thank you so much for allowing us to share a little bit of our story, what we're doing here on the continent with these esteemed guys who are, there's a phrase, salt of the earth, and you got a couple of examples of those folks right here.